Okay, anti-anxiety drugs. In the elderly, we're going to monitor closely for oversedation and profound central nervous system depression. They're very susceptible to these drugs. But everybody is susceptible to postural hypotension, so we're dealing with safety issues here. And benzodiazepines are the drugs of choice within this group. Anti-manic. We're going to focus in on lithium in this group. It's often used with antidepressants for bipolar disorder. You know, the antidepressants helps to take care of the depressive end of the scale, and the lithium helps to take care of the manic end of the scale. There are severe adverse effects with this drug, and people need to be told you gotta report these to your healthcare provider. Cardiac dysrhythmias, vomiting, vertigo, extreme hand tremors, sedation, and muscle weakness. Now there are other milder effects, adverse effects: extreme thirst and urination, nausea, diarrhea, and anorexia. So we really need to be encouraging these people to be drinking a lot of fluid. Yes, they're thirsty, but they're losing a lot of urine, and if they're having a bunch of diarrhea, they're losing a lot of fluid that way as well. We need to be monitoring serum levels. A therapeutic level is 0.6 to 1.2 milliequivalents per liter. And once you get up to 1.5, that's not a whole lot more than 1.6, right? So close monitoring is needed. 1.5 to 2.5 milliequivalents per liter is considered toxic. Got lots of GI discomfort, more than what we just said. Tremors, confusion, somnolence, that's sleepiness, severe sleepiness, seizures, and death can occur at these levels. Antidepressants. There are many cautions and contraindications and interactions with these drugs. Again, tell the person it's going to take several weeks before you really see an improvement in symptoms. But we have to be monitoring people closely during this time and assess them for suicidal tendencies and provide support. As they start taking the drug and it just starts to work, the depression might ease a little bit, enough that people can make a plan. And that includes making a suicide plan. So it's the early weeks of these drugs that we're most at risk for suicide. However, it can be any time that somebody is depressed. These drugs have a lot of adverse effects. They tend to be constipating, so we want to talk to them about lots of fluid and fiber in their diet. Dry mouth, so we're talking about hard candy or gum, and good oral hygiene. Sedation, drowsiness, weight gain, sexual dysfunction. Now when you look at this list, wouldn't some of these things make anybody a little bit depressed? Well, we're giving this to somebody because they are depressed, so they really need to have the talk therapy going along with them to take care of talking out some of these side effects. Again, we're worried about the elderly and weakened patients because of the risk for falls, because of the drowsiness and the postural hypotension. Tricyclics in particular need to be weaned and discontinued before surgery to avoid interactions with the anesthetic drugs. The MAOIs, they take 1 to 4 weeks to start working, and they may take up to 2 weeks to be cleared from the system after they stop. Why is that important? Well, because of the tyramine-containing foods they need to avoid. There's a hypertensive crisis that can occur if they ingest tyramine-containing foods. That includes aged cheese, such as cheddar, wine, beer, avocados, bananas, canned meats, yogurt, soy sauce, packaged soup, and sour cream. So all of these need to be avoided if someone is taking an MAOI antidepressant. Antipsychotics, the phenothiazines, tend to make people sensitive to the sun, photosensitivity, so they need to wear sunscreen. Antacids and antidiarrheals need to be avoided within an hour of taking the dose. And alcohol and central nervous system depressants do not mix well with this. People have to avoid them. Long-term use of haloperidol, which is Haldol, can result in tremors, nausea, vomiting, or uncontrolled shaking of small muscle groups. And these symptoms should be reported immediately to the provider, healthcare provider. All right, the oral forms need to be taken with meals to decrease GI upset. But, as in 2 slides ago, they're taking them with food, but they're not taking them with antacids or antidiarrheals. These drugs can cause drowsiness, dizziness, and fainting, so they need to change position slowly. What does that tell you? If this says change position slowly, that tells you it's probably postural hypotension. Monitor for therapeutic effects. Regardless of the drug, we're looking at level of consciousness, alertness, how are they thinking, that's the cognition, their mood, can they carry out their ADLs, what's their appetite, what is their sleeping patterns. And we're looking at their potential for self-injury, especially in the beginning of the therapy, but throughout the therapy it's also important. Monitoring for therapeutic effects of the I can never say that word, anti-anxiety drugs. Well, yeah, fewer anxiety and panic attacks, better alertness, they sleep better, they have less tension and irritability, they have less feelings of fear and doom, and they're more interested in themselves and others. If we're looking at antidepressants, well, depression itself can be associated with sleeping all the time, or it can be associated with not sleeping at all. So one way or the other, if these drugs are working, they should have better sleep patterns and better nutrition and feel better about themselves and less hopelessness, and they take care of themselves better, they look better, they're dressed better, they've got better hygiene, they've got increased interest in all their daily activities. Antipsychotics, they've got a better grasp of reality, decreased hallucinations, delusions, less paranoia, less psychotic symptoms. And for lithium, less mania. Again, here's your therapeutic levels, 0.6 to 1.2. That's where we want them to be, no higher. Higher than that, we're starting to look at toxic levels.